Assalamualaikum warahmatullahi wabarakatuh, and very good evening. I hope everyone stay safe, stay healthy during this pandemic. Ta'ubi level lecturers, I hope you're doing very well. And this is our group, which is consist of myself, Tengku Aziz, Tengku Azman. Next is Nur Liana Izzati, Nur Syafika, Muhammad Arif Zafaruddin, Muhammad Izul Amir, and Atika Zahar. Okay, before that, we move to the first is the introductions to the presentation, which is our presentation for today is all about the Sungai Buloh Hospital as one of the organisation hold the responsibilities during this pandemic basically. Assalamualaikum warahmatullahi wabarakatuh. My name is Tengku Azlani. Today I will present the introduction of the organizations that we choose, which is Sungai Buloh Hospital. Before we moving forward, let we explain where is located of the Sungai Buloh Hospital. Basically, Hospital Sungai Buloh is located at 25 km from the Kuala Lumpur City Centre, and this hospital are located at the Mukim Batu district, which is located in Sungai Buloh area and in district of Gombak basically. And this hospital Sungai Buloh has been established in 1929, which is for the first this hospital established for the Pusat Kawalan Kusta Negara in 1929, and also known in English we call it a National Leprosy Control Center. Because why? During that period, Malaya have facing with the leprosy disease, which is known as the Kusta, and the hospital Sungai Buloh has been established at the firstly for the center of the leprosy center for the Malaysian, where there is a ward there, which is the isolation wards have been established in early of 1930 for the isolations of the patient which is facing with the leprosy disease. Okay. But in 1999, Malaysian government have a major renovations involve the 130 hundreds acres and with the complete accommodations and facility and equipment of the hospital Sungai Buloh. Until now, they have about 620 beds in the hospital Sungai Buloh, and also they have a very specific excellent center for some of disease basically. This is how the Sungai Buloh become the organisation that play important role in the pandemic of cases such as corona and so on. We can look forward for the next presenter, and will be explain me in the role of the Sungai Buloh Hospital basically. Moving forward for the role of Sungai Buloh Hospital, we can see that firstly, Sungai Buloh Hospital is excellent center for infections disease center basically. This happens in early 1930 because they already become the center of leprosy, and then nowadays they are become the center of infectious disease. For example, like coronavirus, because they are infectious disease which is mudah berjangkit basically. So the organisation hold responsible in research, providing isolation ward in Selangor district. This is center. In also in Malaysia, Sungai Buloh Hospital hold the responsible at the center of research and treatment for the infectious disease. And this is one of the role of the hospital Sungai Buloh, to conduct the research, to treat patients, and to serve the patient which have the infectious disease. For example, today we can see that hospital Sungai Buloh their important role in preventing the pandemic of coronavirus basically. They provide the isolation ward for the patients which has the coronavirus. They also conduct the research over there to find the vaccine and so on. They also providing equipment such as more ventilator located at Hospital Sungai Buloh rather than other state, basically because these hospitals are actually the center of infectious disease basically. Nowadays we can see how the Hospital Sungai Buloh busiest hospital in conducting of the coronavirus, which is they have a specialist ward for isolation basically for the coronavirus patients. That's one of the rules of Hospital Sungai Buloh. Next, we can see how the Hospital Sungai Buloh become one of the research institute for the leprosy disease. Basically this happened, we can see that it happened previously, because from the early of established Hospital Sungai Buloh, they are focusing on the preventing and isolation of the leprosy patients. And nowadays we can see that from the research, they are become the research institute which is conducting and research about the vaccines, medicines and treatment to the leprosy disease and patient basically. And they are also have the ward special for the leprosy disease and patient basically. This is the second role of the Hospital Sungai Buloh in research of the leprosy, and they have become one of the institute that located in hospital in specialized in leprosy research basically. This is the second role of the Hospital Sungai Buloh basically. Thank you. Moving forward, as a hospitals, modern hospital and full equipment which is received as achievement, ISO and so on. One of the excellences of the Sungai Buloh Hospital, basically this is center for the neurosurgicals and also maxillofacial surgical, which is Hospital Sungai Buloh, one of the organization hold the responsibility, have the specialists in the type of surgical of neuro basically, because the Hospital Sungai Buloh have the specialists in neurosurgical basically. Their specialists in Malaysia are basically are located there. So people around the Malaysia in Sabah Sarawak from west, south, east and west come to Sungai Buloh Hospital to have their own neurosurgical, because in Hospital Sungai Buloh we can see here they have the accommodations, facilities and also specialists that hold the title as expertise in the neurosurgical and also maxillofacial. This allowed them to become one of the organization which are conducting the neurosurgical and maxillofacial surgical over there. This is how the hospital are playing roles as one of the organization in conducting the surgicals and so on. From that we can see that the Hospital Sungai Buloh hold the various roles as a hospital organization, not just in treatment of the peoples, but they also conduct research. They also have to treat the people and preventing and so on. That's all from me. Thank you.
Hi, my name is Shafika with Ahmad Ramli. I will continue with the challenges in public relation in health sector, which is Hospital Sungai Buloh. Okay, firstly, the challenges that happens in Hospital Sungai Buloh for the public relation is they are preparing for the danger zone. As we know, this pandemic COVID-19 is giving dangers for everyone, with having physical contact with one another, especially for doctors and nurses who treated the patient. So in Hospital Sungai Buloh, they are having that challenges with treating patients while closely can get possibility of getting the positive COVID-19. while they are performing the intubating. As a information, intubating is a procedure that must be close to a patient's face. Hence, patients will cough or gag when intubating session. So it will be a challenges for them to face it. To make them not in the danger zone, so Hospital Sungai Buloh using the PPE and use the transparent plastic cover to distance them from the patient. Okay, the challenges public relation in Hospital Sungai Buloh is the communication. The communications that happen in the public or in the Hospital Sungai Buloh. The one of the problems that making public relation in the health sector chaos is that people is spreading the fake news about the COVID-19. It making more public people more panic about the fake news. So as our country are fighting this pandemic COVID-19, having the fake news is as the dangerous as a virus, because people will be panic to know about the misinformation that the fake news spreading. The communication itself must be conducted by the credible spokespersons such as doctor, nurses and so on, so that we can get the accurate information about the COVID-19.
My name is Nur Atika Azhar and I'll be explaining on the public relation function in Hospital Sungai Buloh. At first, we have to define the public. The idea of the public is the first and most critical role for the public relations officer and the whole hospital. The early use of the word was to understand the two fundamental meanings. One is used in the term res publica and is related to the general use. Transparency and the usefulness of the word to the public. And in the second example is the term refers to matters of general importance or more precisely to official and public relations. So we can divide public to the internal public and the external public. The definition of the public will begin by isolating the internal and external public, taking into account the large public health system, such as what the internal population of one hospital can do, including patients, doctors, or friends, medical personnel, patients, family, hospital management, and others. Public relations tend to describe the external public of the hospital or clinic after identifying the internal public. The external public could be newspapers, policy leaders, state or local council, state health departments, or municipal council. The definition of internal and external public helps us to better understand the concepts of health and public relations, but also to connect them in a new definition. In line with this perspective, public relations in health contact phase of health agencies such as hospitals, primary health care centers, and all associated organizations with their internal and external public are structured to promote mutual respect, empathy, and common interests. So functions of public relation of Hospital Sungai Buloh during this COVID-19 pandemic is to communicate. The hospital has several markets to target, and each Audience wants personalized messaging that stress their significance in different tones and different language usage. For example, by talking with the public, residents or non-citizens about the danger of COVID-19 virus, it would be possible to transmit it quickly. The hospital stressed to all patients who had come for tests or some of the disease that they had to help minimize the spread and how to do so. Other than that, the public relation in the hospital need to advise the hospital as well. There is an increasing risk of potential crisis due to constant worrying patterns and the number of infected patients, as well as the number of deaths due to the pandemic in Hostel Sungai Buloh. Public relations therefore offer outsiders a different perspective and outlook on the problems to be helped during the crisis. This is to ensure that the messages have been spread across the nation and make people aware of the risk that the hospital is facing. This is more objective and often creative approach that can also help to make daily recommendations and provide advice for more effective business communication. In addition, the public relation department of Hospital Sungai Buloh need to ensure that the enhancements of the business growth. This essential. This is essential, especially in this pandemic, to ensure that the hospital still trusts the management to pursue their responsibility to the nation and the citizen by building strong identities and disseminating messaging and knowledge that customers need. The hospital welcomes visitors, retain healthy relationship with old people, and nurtures the confidence that supports them. Customer relations, like all public relations activities, include techniques that need to be incorporated into the advertising, marketing, and management departments of the company. If done correctly, these strategies can be time consuming and thought consuming, but is worth the effort. They will improve the brand, contribute to stronger media attention that leads to dissemination of real knowledge about the outbreak, and elicit positive reviews and eventually end the pandemic.
Next, we continue with the issue of the public relation at the Hospital Sungai Buloh. There are many crises or issues that they're facing recently. Firstly, the operating system or health information system, or in short form is HIS. The problem occur when the system is having trouble with their operating system. This is because they use Windows XP as their database, which is no longer support many software and application which nowadays there are Windows 7 and Windows 10 that are more powerful, and basically Windows are not provide technical support for the Windows XP. This result difficult in MRI, CT scan, X-ray, and to check the previous patient history or treatment or appointment. Therefore, it leads to dissatisfaction among the patient when they came to the hospital, but they cannot proceed with the appointment because the doctors don't know what to do and don't have the record. Secondly, the COVID-19 issue. We know that the issue is the pandemic level, which the global every country in this world are facing the issue. Our medic team is overburdened, especially at the public hospital. Why? Because Hospital Sungai Buloh is central of the infection disease such as this COVID-19 novel coronavirus. When the positive patient in the Peninsula Malaysia will be transferred to the Sungai Buloh, because they are more advanced technology and enough equipment and facilities to treat the patient. This also keep question the people, for the people that does not know why the patient should be transferred to the hospital. Meanwhile, there are many public hospital around Malaysia, in the Malaysia. Therefore, it creates as the public relation, they are facing challenge and also victory in same time. Why? Because issues such as MH370 and money laundering such as MDB has give bad reputation to the Malaysia, but the COVID-19 has changed the name of Malaysia as the top country in Asia that best to keep the safety of the people.
Assalamualaikum. My name is Nolana Izzati binti Muhammad Yaakob. I would like to explain how Hospital Sungai Buloh overcome the situation. So, firstly, Hospital Sungai Buloh overcome the COVID-19 situation is built more screening unit. The Sungai Buloh Hospital with more than 200 volunteers comprising professionals including doctors and engineers are working together to develop a prototype coronavirus mobile test combat unit to take samples of suspected COVID-19 patients. The combat unit provided solutions to the current shortage of personal protection PPE. Personal protection equipment PPE faced by frontliners, and to getting samples fast, efficient and safe. So the first prototype combat model, which has been installed at the Sungai Buloh Hospital, was equipped with facilities for people with disabilities, air conditioners and satellite communication system to ensure that all data obtained could be passed to responsible parties such as the National Security Council and Health Ministry. So the combat unit could also be turned into a post-COVID-19 negative pressure room to treat patients with respiratory symptoms and fever without having to send them to the emergency department to avoid risk of infection. It is because Sungai Buloh Hospital will be the main dedicated healthcare in the coronavirus infection. Next, Picasso provide hemodialysis machine to Sungai Buloh Hospital. The hospital was accepted for hemodialysis, which amount 160,000 after the Prime Minister reviewed the situation of patients and hospital equipment. Datuk Dr. Khalid Ibrahim, as a director of Picasso, said the hemodialysis machine was donated in collaboration with the Ministry of Health. The Prime Minister, aware of the problem of the deficiencies in the machine, and take the action to increase the equipment as soon as possible. The increasing of equipment can help to resolve the problem, which patients do not wait too long for undergoing dialysis treatment at the hospital. It can reduce the waiting period by 3 to 4 months for the patient. By this method, the patient's satisfaction is certainly considered as an integral part of the quality of care. Furthermore, patient satisfaction is identified as an important dimension for assessing the quality of healthcare services. Lastly, improving patient records. Computer-based patient records and the system in which they function are becoming essential technology for healthcare because the information management challenges faced by healthcare professionals are increasing daily. It can play an important role in improving the quality of patient care and strengthening the scientific basis of clinic practice. They can also contribute to the management and moderation of healthcare costs. Technological progress makes it possible to accurate patients' care data and offer improved performance. Current patient record cannot adequately manage all the information needed for patient care. Paper patient records have not kept and cannot keep pace with the rapidly changing healthcare system. More research and development are needed in several critical areas to ensure that system meet the needs of patient practitioners, administrators, third-party payers, researchers, and policy makers. For example, the need to protect patient privacy must be balanced by the need for timely access to data at multiple sites. System must offer both considerable flexibility for users and standard required for data transfer and exchange. So that's all for me. Thank you.
Okay, Assalamualaikum warahmatullahi wabarakatuh. So my name Muhammad Izul Amir bin Muhammad Khalid. Okay, today I will conclude this case study, which is about the public relation in Hospital Sungai Buloh, Selangor. So to be conclude that there is a lot of things that happen in Sungai Buloh Hospital. Okay, then this hospital is one of the busiest hospital in Malaysia, which is that this hospital is the government hospital, and then this hospital are the center of the hospital that treat the patient that have the major disease, such as we can see before this our country facing the kusta, and nowadays in 2020 our country and all country in the world are facing the same virus, which is the coronavirus COVID-19. So there is a lot of challenges that happen that been faced by this hospital, and also there are a lot of issues that being faced. And one we can see that every hospital also have the major what we call it system, which is the old version system, and also they need to be overcome it, because we are along with the new modern technology, so we need to have the new modern technology to collect the data record of the patient. Okay, collecting the data semua, all of this needs to be done by the system, IT system in this hospital also. So that's all for me, and alright, thank you.